Hello, I'm Dr. Vincent Bellonzi and I'm a chiropractor. And I want to tell you just a short bit of what a chiropractor does. Chiropractors practice functional medicine. That's probably the best definition I can give you. We'll get into that a little bit. So in chiropractic, what we want to do is improve function. Chiropractors do nothing more than to mobilize joints that are fixed. It's not necessarily that they're way out of place or anything like that. It's a matter of having normally functioning joints as closely as we can. If we have normal movement in the joints, normal function, then we have a situation where we've got good nervous system function, we've got good circulatory function. So we've actually enhanced the body's ability to be well, to be healthy, because disease is dysfunction, and if we can create function, if we create your body in a way or help it to be working the way it's supposed to, then we've eliminated disease. So chiropractors start off by examining the human frame. They want all the joints in the spine to be functioning normally. They want all the joints in your body to be functioning. So they do a technique called an adjustment. Chiropractic adjustments are as specific as possible. The idea, again, is to mobilize the joint, not to crack anything, not to break anything. And many chiropractors, like myself, also look at other things that apply to this same function. I'm board certified in nutrition. I do a lot at looking at people's nutritional status. Are they actually eating, first of all, the correct choices of foods? Because it makes a big difference. It really does. Are they absorbing the nutrients that they need for their body to function? That's really the most important step. So we have to look at gut health. We have to look at how well the gut is functioning. It's over 60% of your immune system. So if your gut's in trouble, your immune system's out of balance as well. So many chiropractors work with nutrition. There's a lot of laboratory testing that we can do to establish whether or not you are digesting and absorbing the way that you should. We can also go to the other side and look at metabolic function. You can actually tell through some lab testing whether or not your body was functioning based on, say, what waste products show up, based on certain cycles in the body working or not. So there's a lot of ways we can approach this. And most of all, chiropractors and functional medicine practitioners are all about helping you design your lifestyle so that it fits with your genetics. And no longer do we talk about the fact that genes are any more than a risk predictor. They're not a determinant. Just because I see something in your genetics associated with a disease does not mean it's going to occur. So if we understand that what you do in your lifestyle, your level of activity, the choices you make in the food that you actually consume, the types of things you're exposed to in your job and your home and everywhere else, you have to consider the burden that it might place on your body that takes away or interferes with function. So again, chiropractors use a tool called the adjustment to mobilize joints. Now in my office, I actually have a couple different techniques. There are many techniques out there. I have what's called a flexion, distraction, and drop table. It gives me a few tools to help when I do hands-on adjusting, which I really enjoy and can be very effective. I also have a piece of equipment called a Pro Adjuster, which is a computerized tool that can measure whether or not the joint has function, and it can actually make an adjustment by doing a light tapping that's very quick until it can measure that the joint has basically been mobilized or moves a little. So the tool helps me to be much more specific and to know when I've done enough to get the joint to give way or move. So however you do the adjustment, it's a tool, and it's a very effective tool. You can use adjustments, or adjustments have been known to help with everything from asthma to earaches. Of course you know it helps with back pain. Of course you know chiropractors can help you with shoulder, knee, other joint pains. Many chiropractors specialize in sports therapies and treatments. So again, as a chiropractor, I want my goal to be to help you get your body working well enough that you eliminate diseases and not just give you a diagnosis. Because I can sit here and tell you that you've got a 724.8, you've got pain in your low back. Have I really helped you? We've got to do something about it. So don't get stuck with just identifying a problem. Find out where the problem comes from. That's chiropractic. So come see me in my office. Be happy to talk with you, demonstrate what we do, talk about it. Pure Health Design, info at austinphd.com if you've got any questions. Thank you.